Thank you very much, Julie. Well, folks, this is the last panel. We saved the best for last. No question about it. Yeah. So thank you for being with us here in the final stretch before we move to our reflections stage. And so to sort of set the table, I started off many years ago in the world of lead hazard control in healthy homes. So this is very near and dear to my heart. And I'm excited about this panel, and I'm excited about the benefits, particularly on kids most in need, that are demonstrated through this work. It seems to me that healthcare and public health are separated at birth. We've been working with all the best intentions, just on parallel paths. The work around asthma control presents a perfect opportunity to demonstrate collective impact on health benefits through practical application of the strengths of both professions. 2012 data from the National Health Interview Survey show that more than 10 million U.S. children have been diagnosed with asthma. Medicine and public health collaborations can have a particular benefit for those who bear the greatest burden from asthma, often low-income and minority children. Asthma can pile on to the compounding disadvantages of poverty, as asthmatic children are more likely to miss school and fall further behind. Missed parental work days as parents care for their asthmatic children also serve to expand the opportunity gap. Clinicians work to optimize care and manage exacerbations, and public health and partner agencies can provide the data, the educational reinforcement, environmental assessments for trigger identification, and assurance and remediation of these triggers in the home environment. We know the triggers in the home: mold, dust mites, cockroaches, rodents, tobacco smoke, and household chemicals are among the culprits. Wet basements, leaky roofs, old carpets are common in substandard housing and pose risks to those living with asthma. This work has its roots in the successful experience with lead hazard control, where medicine and public health have a long-standing relationship around case identification and referral processes, leading to interventions that reduce exposures. Similarly, public health partners can be the eyes and ears of the clinicians in the home environment. I've had many conversations with pulmonologists over the years who express frustration about multiple emergency department admissions among highly activated patients who are following the recommendations of their clinical care plans and yet continue to have difficulties. We know that asthma trigger reduction in the home works. Demonstration projects in places like Seattle, Fresno, Oregon, Cleveland, and we heard today North Carolina, and soon we'll be hearing about our friends from Boston, are providing the necessary evidence and designing the playbook to take this work to scale. For example, a recent pilot involving doctors and public health workers in Cleveland led to a 58% reduction in hospitalizations among low-income children with asthma. And some of the numbers are even better, and I'm looking forward to hearing those. All these efforts are now opening the door to sustainable fee-for-service opportunities with public and private payers. These successful collaborations build respect and trust, which open the door for broader initiatives and powerful population health alliances. The reunification of healthcare and public health, since we were separated at birth, is clearly underway, and the health of our communities will be better for it. Successful asthma control collaborations will help to show us the way. And so I can't think of a better community to be here today to show us what they've learned and to demonstrate that reunification. We have with us Margaret Reed, who is the director. Margaret is the director of the Division of Healthy Homes and Community Supports at the Boston Public Health Commission. She goes way back. Remember the early Healthy Homes days with HUD, going back more than 10 years ago. And so she's very well respected and well-known worker who understands this work and is very passionate about particularly those most in need. Sherry Nethersole is the Executive Director for Community Health, Boston Children's Hospital, and an Assistant Professor of Pediatrics at Harvard Medical School. So our speakers are going to share their story, a multimedia presentation for you this afternoon. They're going to share their story, and there'll be an opportunity for all of us to ask questions. So I'd like to turn it over to Sherry to begin this afternoon's session.